Hello viewers, I'm Daniel Kasahon with this edition of the program on Ethiopian language that entertains some issues on Africa health business. To respond to some of my questions, here with me is Dr. Amit Thakker. He is Executive Chairman of Africa Health Business. He is also Chairman of Africa Healthcare Federation, founder and board director of the Ethiopia, the East Africa Healthcare Federation, and chairman of Kenya Healthcare Federation, and the co-founder of Avenue Healthcare. Welcome to the show.
Thank you. It's a pleasure being here.
I've read some points about you from the social media. A comment about you.
That's right.
I caught. Amit taught me ways to communicate, and in round table days, he was my mentor. Learned a lot from him, and yet he has a lot to offer, which helps one in business, personal life, and in relationships. He taught me how to be a good presenter and MC at functions. Close the quotation. Can you tell me a little bit about you, how you have become an influential figure?
I grew up in Kenya, in a town called Mombasa, and studied my way through in Nairobi before going to medical school and qualifying as a doctor in '95. I founded my business with the main aim of providing affordable quality healthcare for a large number of people. It was during these first 5 years of having founded Avenue Healthcare, I realized that much more needs to be done, not only in Nairobi or in Kenya, but throughout Africa. So my journey began on how we can become innovative, and you really don't need to become poor when you're sick, or you don't need to be denied care when you don't have money. That's when I realized that actually financial innovation and provision of care is very interlinked, and the government policies are very critical in how the poor will or will not receive care, and those policies determine lives of many communities. So in my journey of doing private business, I realized it's critical to engage government effectively through a constructive engagement, because very often private sector is very quick to criticize government, and they blame them for everything that's wrong in a country. Sometimes they are right in a few things, but we realized that the best way to solve the problem is to have a dialogue that's going to engage them to make the difference. So I think my journey really began there. How I reached the position I did, I think, is because of my passion and my true belief that it is only together we can make a difference in healthcare, both public and private.
Okay, your interventions in Africa health business aimed at fostering private-public sector partnership, support capacity building, and engage the private sector in effectively using information technology and other innovative approach to reduce maternal and newborn deaths. These are among others. And I think Africa Health Business has made 3 years.
That's right.
And what have you achieved so far in the aforementioned points?
We've become actually the leading convener for bringing both public and private sector together. We've achieved a network of leaders on the African continent who want to make a difference in healthcare. So that's great. We've achieved that. We've created a good network. The second thing we've achieved is we've started creating inroads for foreign investors who want to invest in healthcare in Africa. So large companies, like you've seen some from Japan in this symposium, we've seen countries from Germany, we have created an atmosphere for them to invest freely into some specific sectors on Africa. So that's been our second achievement. The third achievement is something we're very proud of, is letting African companies expand within Africa. You don't need to remain in South Africa or Nigeria or Egypt. So we have started creating a sort of a channel of expansion for African companies to serve more Africans so that we can have a healthier continent. These have been some of our achievements through the work that we do in our consultancy field. On the advisory side, we have started working with governments of different African countries in coaching them on how to engage with the private sector. Right now, we are in the middle of creating a private healthcare federation in Liberia. And we are working very closely with both government and private sector so that they have a great mutually beneficial relationship to benefit the whole health system in the country. Some of the achievements I wanted to share with you.
All right, that's great. Congratulations. And what can you tell us of the latest healthcare trends and networking in Africa?
The time is right. It couldn't be better. The political goodwill that we have is the highest ever, at least in my lifetime. You've got the heads of state, you've got ministers of health. They are all making health as a priority. Take Kenya, for example, when His Excellency Uhuru Kenyatta declared the big four areas of his focus, health is one of them. When you look at Africa Union, that met in Addis Ababa in February, before President Kagame handed over to the new chairperson of AU, they only discussed one agenda, and that was health. So we have political goodwill, which I've seen as a positive trend. We've got the ministers of health who are effectively engaging every stakeholder, including private sector. That's also a trend that I've seen. And this public-private partnership is getting great energy from the stakeholders. From the private sector side, the trend I've seen is that we need to try and reduce costs of healthcare for the people on our continent and improve quality. There are many people who still don't practice healthcare to the standards that we like. So reducing costs and improving quality is a trend, and private sector is leading the innovation and technology side of bridging this gap. Our theme in this symposium was integrating Africa, bridging the health gap. And what's coming out? One key promise is the promise of digital health. That will bring healthcare closer to the people, which will be more affordable and improve quality overall.
It's more affordable?
Yeah, because of telemedicine. How much money do you spend traveling from your village to a health facility? That transport costs could be reduced if we had telehealth, where you can dial in a doctor and you can dial in a pharmacy and you can actually be able to get your diagnosis coordinated using technology. If you don't have to go to a bank, maybe you don't need to go to a clinic to get health. And these are some of the promises. The use of mobile phone is going to be so important that apps are going to give you an indicator on the status of your health.
That's nice. Your organization encourages African governments to carry out reform programs that will foster public-private partnership in healthcare and investments.
Yes.
How do you think that this is going to be realized? That the context in Africa is conducive for it?
So it's a very good question, and I knew you were going to ask me that question. I would say there has been a dramatic change in the last 7 to 8 years. Why? Because we've got young ministers of health who are proactive, that are taking charge in many countries in Africa. Like, for example, His Excellency Amir Aman, the Minister for Health for the Federal Republic of Ethiopia. You can see the excitement and the reforms happening live. You can see that there is an openness about investments in pharmaceuticals. There is a drive towards training more health workers. There is a drive towards establishing more health centers and facilities. And these are all part and parcel of a reform. And those reforms done today are going to give health for the people tomorrow. So, some countries in Africa are very progressive and some are still very slow. And those are the countries we're worried about. the slow starters of reforms are going to still have maternal mortality that's high, children who may not live longer than 5 years, infants who die after birth for unnecessary causes, blood not available in the health system. These are all signs and symptoms of a weak health system where leadership at the Ministry of Health is weak and not embracing reforms for a better tomorrow.
You see gaps in healthcare sector.
Yes.
You have held a symposium here in Addis Ababa under the theme integrating Africa, bridging the from these three.
It's tremendous. What we've achieved is, first, we've been able to get all the African and global health leaders in one room. That was a great achievement. Number two is we've got commitment from global partners like WHO, Global Fund, and many others that working together with the private sector is non-negotiable. That was clear. One great achievement was we had the ministers of health staying with us through the 3 days. As we speak, on the third day, they are still in the plenary engaging with us and the champions from the private sector on how to improve health systems in their country. That to me is the greatest achievement. It's a learning that the countries are going with. So the companies are teaching countries on what makes the companies more efficient. We talked about human resources for health. We have spoken about digital health. We have even spoken about innovations in non-communicable diseases like diabetes, hypertension, and many other areas. So I think the greatest achievement has been the learning, which many of the delegates are going to take back with them and change the health systems to impact lives of millions of people on this continent.
Would you mind telling me more about the health gaps in Africa and possible solutions to narrow the gaps?
Yeah, it's a tough question. I can tell you we haven't answered that question. We are just beginning to talk about it. But the gap between the rich and the poor, and those who can afford and those who can't, is very clear. In fact, Africa is seen as the continent which has the widest gap between those who have access to good quality and those who don't. So we have agreed that the priority must be the poor and the vulnerable first. How do you ensure that we bridge that gap? Responsibility has been given to both parties, the public and the private sector, to answer your question on bridging the gap. The public sector needs to become more efficient with the tax money. They should use the tax money more effectively, more efficiently, and prioritize the vulnerable groups so that the poorest of the poor receive health care first using tax money. If that happens and we reduce all types of graft in the ministries of health, we will produce more health with the same money that the ministries of health are getting in Africa. That was responsibility number one. The second responsibility is for the private sector to be responsible corporates. There are many private sector organizations who provide poor quality of care using non-qualified health personnel and pretending to have doctors and nurses, and you get botched cases. You also have many private organizations that trade in counterfeit and fake medicines, equipment or supplies, taking advantage of the system just for profits. So we call them the unscrupulous group of players.
Don't you see challenges in policies and governance and in integration of the private sector in Africa?
Yes, we do. But at this point, we find that our progress is even faster than what we thought. Why? Because the new leaders in many countries are of a different mindset. It is the change of mindset that's driving better health for the families in Africa. The ministers of health in many African countries now have changed their mind about how to engage private sector. So the policies are changing. They've changed their mind about the usefulness of the private sector. They've changed their mind about what is profits and what is responsible behavior. This is giving us a total framework of true engagement for better economic growth, creating new jobs, and stronger health systems. This is what is driving Africa to bridge the health gap.
Whatever how you may try,
Yes.
unless there is a proper response to basic services in Africa, I think it will be hard to achieve your goals. Water, food, and sanitation, there are still major problems in Africa. So how do you think that universal healthcare can be ensured?
I'm very happy you asked that question. In fact, what came out, you just reminded me that we now need to just stop talking between healthcare stakeholders. We need to have interministerial linkages. The Ministry of Health must speak to the Ministry of Water. They must speak with the Ministry of ICT, Science and Technology, Ministry of Education, Ministry of Agriculture. So the linkages are so many because it's the social determinants of healthcare that need to be looked after rather than finding a pill for every ill. It's not the drugs, but the communities could be healthier if they had strong nutrition, good sanitation, appropriate water supply. So it brings us back to the point of back to basics. Can we ask the families to look after their own health first in the best way possible? What do they need for that? If they need appropriate infrastructure, water supply, the Ministry of Health should be lobbying and advocating for those kind of services to reduce the health burden. So I totally agree with you. It's another challenge. It's a balancing act of how much of the resource should be allocated to agriculture, infrastructure, water. But if we had all those amenities, I think our outpatient visit rate in Africa would reduce by almost 40%.
All right. In a nutshell,
Yes.
what can you tell us about the health facilities or the health sector development in Ethiopia?
I am very, very impressed with the progress in Ethiopia. You are being identified as a country that is looking at producing more health workers. You have a high number of community health workers getting into the system. You're paying great attention to people. And you also have a resource because it's a country of more than 100 million people. So that came out very clearly. What I can tell you is Ethiopia is also trying to become a manufacturing hub, using power costs as an advantage and using incentives like tax holidays, especially in the pharmaceutical industrial park. So I see that as a big drive. You have competitors next to your countries, and I wish you all the best in that drive. It's a tough one. And the third one is I see that Ethiopia has an open call for public-private partnership for tertiary care. I heard clearly from the minister that anyone with interesting ideas on tertiary care, he also added outsourcing, catering, laundry services, sterilization in facilities. So an openness in public-private partnership is what I see. I think Ethiopia has set a great foundation to springboard to an effective health system in the next 10 years, as written in its transformation, health sector transformation plan.
Despite all the success you mentioned, still pneumonia, diarrhea, and malaria are ravaging this country. What do you think? What went wrong here, and what do you suggest?
I think public awareness needs to improve. Education. Let people know that if you have water that you use in your home, somehow try and heat it up, remove the impurities. If you are going to fetch water from places where it's contaminated, try and deal with it. It's those basic homestead public education that's going to reduce the diarrhea, pneumonias, malarias, remove stagnant water. So responsibility for healthcare in Ethiopia must be shared. It's not just the Ministry of Health, but it's also community. And for that, public education needs to be simple, accurate, and regular, because people tend to forget these things. That could be one way of simply dealing with the pneumonia, diarrhea that you've been talking about in the challenges of the system.
All right. There are scarcities of resources here in Ethiopia.
Yes.
And also weak institutional and human resource capacities like many neighboring African countries.
Yeah.
How do you think that these challenges can be tackled well?
Yeah. With technology, I think it's proving to be nice to engage in e-learning systems. So a surgeon or a neurosurgeon or a dental specialist, if those specialists are not available, there could be some e-learning courses or there could be some exchange programs. Your universities and your technology centers and your polytechnics are increasing. And I can see that the number of intake of your medical students has increased in the last few years. So it's moving in the positive direction. The specialist cadres that are absent in Ethiopia, I think it would be worthwhile doing some kind of an exchange program with the neighboring countries, like you mentioned. So let's say if you don't have a neurosurgeon or you don't have enough, and Kenya has a few, maybe we could have a program that can have the services shared between the countries. And that's why we are here today talking about regional togetherness.
Yeah. How about business with hulls in Africa? What do you mean? You mention business with hulls in Africa. What do you mean when you say growing the business with hulls in Africa? How is it possible?
It's possible if the environment is enabling. Let's say the taxes are low. Let's say you have reduced duties, VAT, and let's say you have enough resources, human resources and infrastructure to engage in building new hospitals. So that would be growing the business of healthcare. So if you have 50 hospitals in a city and suddenly in 10 years you have 200, you have more facilities, therefore you will improve your quality and reduce your costs, like developed countries that you've seen. You will see specialized centers like cardiac, kidney, asthma clinics, allergy clinics coming up. You will have sharing of knowledge between our country and the other advanced countries. As you have less people traveling outside your country for treatment, this is what we mean by growing the business of health in Africa. More factories to produce medicines, more academia and research institutions, because government cannot do it alone. The resources are limited. Only then will we see a strong health system. If the private sector grows and the government starts looking after what I told you in the beginning, the poor and the vulnerable. If they look after the priority group first and let the private sector look after those who can afford, you will have a happy, prosperous nation.
What do you suggest as the priorities for affordable health in this continent?
Partnership. That's what I suggest. Partnership. There's no two ways about it. So if we have partnership with leadership, you have a super formula to deal with exactly what you've asked. Affordable quality healthcare for all. That's all we need.
How do you bring them together?
You choose the right leaders, and the citizens have a role to play. When you vote responsibly. Select leaders that you believe are interested in the people and not in their own personal gain. That's the first step. When we find the right leaders in the right position, you will see that they'll find the right partners to bring in, to multiply the health needs and the health solutions actually that are required in the country. That's how we do it. You should not, to the viewers who are listening to this program, I'll tell them that leadership starts with you. It's your vote that counts. And that determines health of your children and your future generations. Vote responsibly, choose the leader that you believe is interested in the citizens' welfare, not the person's name that you can pronounce. Competence over community is the answer.
Thank you for your time, Dr. Amit Thakker. You are Executive Chairman of Africa Health Business. Well, dear viewers, that's all of the program in this edition. Until I see you next time with yet another edition of the program. Bye-bye.